Welcome to It's Your Case, presented by Opacity.com. I'm Virginie Barbaret, your radiologist on demand for this week. Today's example is a 10-year-old male Hungarian Viszla with acute lethargy and Haemoabdomen. Once you have reviewed the radiographs using your systematic approach, then you're ready to watch this video. Now, I will highlight the most important findings for the abdomen in this case. So we know already from the history that there is a Haemoabdomen in that patient. This is visible as a loss of serosal detail in the cranioventral abdomen, but mostly the cranial to mid-ventral abdomen, with this wispy aspect, soft tissue opacity, and loss of serosal detail. This is indicative of a mild amount of free fluids, or it could also indicate some peritonitis sometimes. But in this case, because we know there is a Haemoabdomen in history, that would be the most likely cause for this wispy loss of serosal detail. The second finding on those radiographs is the presence of a mass effect in this cranioventral abdomen. We see here an ill-defined soft tissue mass opacity, which is displacing the small intestines caudal-dorsally and also pushing slightly the gastric axis cranially. We have also the impression that this soft tissue opacity is partially silhouetting with an area which looks like the splenic tail, which is triangular shaped. And in the VD projection, you can see that there is a mass effect here in the left cranial abdomen, and also silhouetting and hiding the area where we would expect the splenic head. So normally with the splenic head, we have a nice triangular shape, soft tissue opacity at that level. In that case, we lose the delineation of that splenic head, and there is a mass effect in that region. So for those findings, the most likely differential diagnosis would be a mass originating from the spleen, which is the most common in that area. So in that case, we could think of a malignant neoplasia, such as an hemangiosarcoma, less likely an histiocytic sarcoma or lymphoma, for example, or we could think of more benign causes for this mass, like a hematoma or extramedullary hematopoiesis. The other less likely differential diagnosis for a mass in that region would be an intestinal mass, or a mass originating from the mesentery, or an enlargement of the jejunal lymph nodes. But that's usually less common than having a splenic mass at this level. Also with the Haemoabdomen, a ruptured splenic mass would be the most likely differential diagnosis. You can see there is also a large mass of fat opacity. You see it's more radiolucent than the soft tissues, so it's fat opacity in the left abdominal wall, and this is more consistent with an incidental lipoma. We see this mass probably extending a bit more also here on the ventral aspect, that we see all this fat opacity and this wispy appearance of the mesentery superimposed to it. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media. Bye.